great yet. I am one of the newer victims of the DOGE cuts under the Trump administration.
This country is undergoing a public health emergency. The decision by the HHS to lay off 10,000 of its public health professionals, including those at the CDC, the FDA, the NIH, is nothing short of a catastrophic dismantling of our nation's ability to protect its people.
A new round of mass job cuts is hitting the federal workforce today. The Trump administration is set to slash around 10,000 jobs across the agencies of the Department of Health and Human Services.
It's truly crazy to me that we are defunding research, but specifically data collection. Like, how are we supposed to know what is happening in this country in terms of outbreaks, when diseases start spreading? Like, how do you think that information is gathered?
Did the government seriously just admit that nearly 20% of the 10,000 layoffs and RIF notices at HHS might have been mistakes?
25 years.
25 years.
25
and you got notified
years.
how?
Via email this morning.
How did you take that?
I am heartbroken. I'm devastated.
You probably deserved it.
On April 1st, ironically April Fool's Day, HHS went ahead with mass layoffs. 10,000 workers gone. Entire teams erased. Including folks at the FDA and CDC who do the not-so-small job of making sure your spinach isn't spiked with E. coli and your deli meat isn't a listeria time bomb. And get this, some workers only found out they were laid off when their ID cards stopped working. 1 minute you're scanning your badge, next minute you're being escorted out like you just hacked the mainframe.
My role was an outreach person for the 988 mental health hotline. So my job was to promote its use and go to events and make sure the public knew about it and how great of a resource it is. And the company that I work for, which is a nonprofit, laid me off because of their impacts on funding, and the money that pays my job is now no longer theirs to give. So, loving it.
HHS is massive, overseeing 13 agencies, including the Centers for Disease Control, the Food and Drug Administration, the Centers for Medicare and Medicaid Services, and the National Institutes of Health. Some staff at the NIH office in Maryland lined up outside that building today, waiting to get inside and see if they were still employed there.
Like I said, we are civil servants. We're here to serve the public. We all work in human services and public health, and we are here to protect the public health. We're here to protect the most vulnerable in our communities and the most vulnerable families and children. That is what we have done here, and that is what our programs do. We're not here for the paycheck. We don't make a lot of money. And I've been here 25 years, and most of my team members have been here a decade or more, and we have been here to serve the public and to work with our state and tribal partners.
It is a direct attack on public health. It's a direct attack on public health, on science, medicine, and the structure, the infrastructure that keeps us safe. The American Public Health Association said it best today. They said, dismantling the CDC and HHS will lead to poorer health and unnecessary suffering and death. This is not the answer. This is simply a reckless decision, and it's going to lead to more disease outbreaks, more medication shortages, more unregulated health threats, and more preventable deaths.
Yeah, so yesterday RFK Jr. says 20% of health agency layoffs could be mistakes. April Fools indeed. This isn't just another headline. Health Secretary Robert F. Kennedy Jr. literally said that about 2,000 people riffed by the Department of Health and Human Services may have been cut by accident. Critical programs like the CDC's entire lead poisoning prevention branch were eliminated, and now entire communities like Milwaukee, facing a lead crisis in the water, maybe you've heard about it, have nowhere to turn for federal help.
And we will not be here anymore to do that. We oversee child welfare. We oversee federally funded temporary assistance to needy families, which is welfare. We oversee federally funded child care, child support enforcement. These are the services that serve the taxpayer, and they are gone. The people who administer these programs are gone. So I don't think the regular taxpayer understands how government works and how these services actually serve them until they don't get their Social Security payment, they don't get their SNAP, they don't get their welfare check. Then they will see how these RIFs will impact them. Right now, it's this kind of, oh, someone else. It will impact all of you, the greater public.
Who do we go to? We don't know who to go to. There are no instructions of what's going to happen. The RIF letters came about 5:15, 5:20 in the morning. So if you've already started out to work, you wouldn't have seen it. Or if you didn't have a work computer with you, you wouldn't have known until you actually got through the line. So that was your notification. Because there was no one even in the lobby or saying, hey, check your email. We just wanted to know, why are we in this line? Why is it doing it? We just knew it was a 100% security check.
Another example, the FDA has had to temporarily bring back employees that were RIF'd, laid off because vital inspections of food and medicine were now at risk.
You probably deserved it.
Hi, I was a worker at HHS. I was fired illegally on February 14th. There are many people who are not getting social service programs, especially people with disabilities. Are you going to do anything to stop what's happening?
You probably deserved it.
I deserved it?
You probably deserved it.
I deserved it.
Dude,
wow.
That's sad.
Yeah, that's great to hear. Why did I deserve it?
Because you seem like a clown.
Even worse, the FDA quietly postponed the 2026 deadline for the food traceability rule, a major safety upgrade, by 30 months. Because when outbreaks happen, why rush to trace them, right? The spin? Officials say no frontline food inspectors were impacted. But here's the thing, they're not just frontline folks doing this job. You need lab teams, analysts, communication pros, coordination experts. Otherwise, you're just sending someone with a clipboard into a jungle with no map. Meanwhile, grocery stores are still stocking shelves, food processors are still running, and contaminated food? Who knows? Bottom line, fewer inspections, slower recalls, delayed safety upgrades, and almost no one left to coordinate the chaos. So, how safe is your next meal? Depends on how lucky you're feeling. What do you think? Comment and let us know. If you like this video, send this to someone who needs to see it. Before you scroll, smash that like button and subscribe, because we've got more stories they definitely don't want you to hear.